Well, 13 minutes after 7. Thanks for staying with us here on Morning Live. Now, today is World AIDS Day, and although there's still no cure for HIV and AIDS, scientists and researchers worldwide are working around the clock towards researching the human immunodeficiency virus, I should say. And just recently, Wits researchers made a breakthrough in the prevention of this illness among women by coming up with an injection that is over 90% more effective than the oral pill currently on the market. And this was unheard of years ago, especially in a country with the highest number of people living with HIV. So to talk to us more about some of the advances in research is Professor Ameena Goga, who's Director for the HIV Prevention Unit at the South African Medical Research Council. Professor Goga, thanks so much for your time. Welcome to Morning Live.
Thank you very much, and good morning to your listeners.
So if we look at the research around HIV and AIDS you look at how far we have come over the past 10 or 20 years, say, if you were in a position to paint a picture of where the world was in terms of HIV/AIDS related perception and what sort of research was done and what that research told us about this illness then compared to where we are now, how would you paint that picture?
So I think we're in a very optimistic phase at the moment. If you compare ourselves to 37 years ago when we documented the first case of HIV in South Africa, we've since then gone through the entry phase of the virus into our population. Then there was the initiation of the generalized epidemic. There was the phase of rapid spread. There was a phase where we described excess AIDS-related mortality. And for the past 12 years, we really have been focusing on impact. So we're in the AIDS impact phase where researchers, policymakers, civil society have come together in an effort to try new vaccines, new preventative methodologies, and to ensure that we're finding several types of solutions to reduce the morbidity and the mortality caused by AIDS. So in your introduction, you mentioned the very exciting study results, the HPT and OH4 study results that compared a long-acting antiretroviral injectable that can be taken monthly, so that's quite a breakthrough, a monthly intervention compared with daily tablets. And it was found to be superior to the daily tablet. And so that's quite a breakthrough for HIV prevention. So it brings lots of hope. And I think this is not the first piece of hope that we've had during 2020. There was also hope brought by the Dipivirine ring, which is a silicone ring that can be used intravaginally. It releases Dipivirine slowly, in a monthly dosage, and that was also found to be very successful to prevent HIV infection. And I think one of the exciting things is that ring has now passed a pre-qualification by the World Health Organization. And so the International Partnership for Microbicides, it's now going to explore registering this product in every country. And so that really brings hope, particularly for women. More women-controlled interventions are needed in every country, and particularly in a country like ours.
And perhaps if we could expand on the reason for that, and just going back to this breakthrough of the injection that is, as you say, over 90% more effective in the prevention than the oral pill currently on the market. Again, you know, you talk about the benefit to women, but why is it so important that women are at the center of this?
Women really bear the burden of HIV in a country like ours. We have a very heterogeneous epidemic. The burden of disease is focused in women, and particularly it relates to the structure of our society, the position of women in society, and gender-based violence. And so if you just had to look at a figure, and if you look at adolescent girls, although they comprise 10% of our population in sub-Saharan Africa, they actually account for 59% of new HIV infections in 2019. And so much of our effort needs to go towards preventing HIV acquisition in women, and young women grow up to be adults and older women. And much of that needs to be directed twofold. One is ensuring that women can control interventions and protect themselves. So that's the first level of prevention and interventions. And the second level is to make sure that within our society, we're getting males more involved from an early age, so that we stop the cycle of gender-based violence and we stop the structural situations that put women in a position of vulnerability. And so because of that, we need to focus particularly on interventions that women can control. The dapivirine ring is one of them. The cabotegravir injectable, which was tested by the 084 study, is another intervention. And just looking at the figures where you have about 460 adolescent girls who become HIV infected each day. If you look at the figure that says 59% of new infections in sub-Saharan Africa in young women, it brings to the fore that our efforts need to be targeted towards making young women more in control of their HIV protection modalities.
Professor Goga, I mean, today it's possible to be HIV positive and have a child who's HIV negative. We've seen the advances in ARVs and many of the other interventions and preventions that you spoke about. But how close are we today to developing an actual cure?
Yeah, a cure is tricky, and it's tricky because of the virus is quite smart. It can remain in reservoirs within the body that is difficult to detect and difficult to eradicate. So research is still continuing to find this cure, but the closest that we've come is to make sure that antiretroviral therapy is initiated as early as possible to drive the viral load down. And then secondly, to make sure that anybody who's HIV infected stays on antiretroviral therapy consistently to maintain a consistently low viral load. Because the general message that we want to get out there is that undetectable. So if you have an undetectable viral load, then you are less likely or almost unlikely to transmit HIV to anyone else. And so, yes, we are investigating the issue of cure, but in the meantime, we have antiretroviral therapy. Start early, make sure that you continue your therapy regularly. And then we have new modalities coming onto the market. So in the absence of a vaccine or in the absence of cure, we have antibody therapy. So we have either monoclonal antibodies or now polyclonal antibodies that are being tested in research. And we're expecting some very exciting results from the AMP trial. So we have that to look forward to. Then we have an antibody that was found specifically in the South African population, so South African women, CAP256, and that's currently being tested in South Africa. So we have quite a bit that we are contributing to and we're testing in South Africa to make sure that despite the fact that we have not yet found a cure, we can make living with HIV normalize. We can normalize it and make it easier by either finding long-acting antiretroviral drugs or long-acting monoclonal or polyclonal antibodies, either neutralizing antibodies or any other such antibodies to neutralize the virus. And so there's a lot of optimism. I think that's the bottom line. There's a lot of optimism and a lot of hope as we move forward over the next few years.
And of course, this year, 2020, has been a year like no other with the advent of the coronavirus pandemic. And UNAIDS say that the global AIDS response, Professor Goga, was already off track in many countries, even before COVID-19 hit. And the rapid spread of it has created additional setbacks. So what is the situation in South Africa in this regard?
So COVID-19 has affected us all, and it's thrown us all off track slightly. But the good news is that HIV and TB researchers in South Africa got together very early in the epidemic during the phase of the first lockdown, and we managed to get approval or recognition for the fact that HIV and TB-related research is essential, and we managed to continue with all the research that we have been conducting over the past year. So none of that has gone off track. Enrollment into studies, retention in studies has been high. And so we're quite optimistic. You heard the 084 study result, and that study continued despite COVID-19. An analysis was conducted despite the lockdown and despite the waves of the COVID-19 epidemic. I think COVID-19 has also made us take stock of where we are. We've learned a lot from the HIV response. And because of that, we have background and we have ammunition to make sure that despite the difficult situation that we're in currently, we don't let important initiatives like HIV prevention fall through the cracks. And so I think researchers, policymakers, and implementers, so health workers, have been pretty much aware of this. And many have strived to make sure that services continue. Yes, there have been instances where services have faltered, but on the whole, there has been a concerted effort to ensure continuation, and research has certainly continued.
And Professor Goga, if you look at our statistics, enviable statistics, given the high rates of infection in South Africa in comparison with the rest of the world. Is there something wrong with our messaging around HIV and AIDS and prevention overall?
I think we have the right messaging. The messages seem to be correct. The policies seem to be correct. I think it's the communication strategies that we need to intensify and focus on, and it's the support systems. So, for example, the messages might be correct, but if you have a young woman going to a health facility, is she getting the attention and the care that she needs when she needs it? Or is she being turned away? So are our services user-friendly? Are they accessible? And are they acceptable to the person who needs them? And that's where we need to focus. So are we able to offer the right treatment or the right preventative modality to the person who needs it when they need it? And I think that's where we need to put our efforts. So the messaging is there, the policies are there. We need to hone in on how we implement them and how we support people who need to take, whether it's antiretroviral therapy for treatment or whether it's infant prophylaxis to prevent transmission from mother to baby. So that's what I would say. It's more a matter of how do we support appropriate implementation to allow access when it's needed.
Professor Ameena Goga, thanks so much for your time. Director for the HIV Prevention Unit at the South African Medical Research Council. And Professor Goga was talking to us about the advances in HIV/AIDS research over the years as the international community commemorates World AIDS Day today.